Okay, so hello everyone. Especially special thanks to all the Nepal students. Good evening and namaste from India. And I'm Dr. Mala Srinivasan, and I'm in charge of all the international courses at Delhi Academy of Medical Sciences, or DAMS, as you all know. And today with me I have Dr. Shubhank Singh, who is from UK. He's a clinician there, and he is working with us for our PLAB courses as well. Okay. So before we start talking mainly about PLAB, which was our intention because it's our new course, I thought first I will give you all a little brief up about the changes in USMLE, talk to you about 5 to 10 minutes about USMLE. I have just 5, 6 slides where I will introduce USMLE and all the changes, as well as what you people can do for USMLE. If you have any questions, you can simply write your questions in the chat box, and then we can start talking about it if required. And then Dr. Shubhank will take over and talk about PLAB and answer all your questions regarding your journey to US or UK. Okay. So I think, should I just start my, it's a small 10-minute presentation which I have given for USMLE. I'm sharing my screen for that, and let's hope that you people can understand what I'm trying to say. Okay. So first things, what is USMLE? USMLE is an exam taken by all doctors who have graduated from their home country and they want to travel to USA to do their MD there. Okay. To do MD, if you want to go to the US, you will have to do USMLE. Okay. So the students ask why USA, just like you can ask Dr. Shubhank why UK. So since I'm handling USMLE for the last 30 years now, I can tell you the advantages of USA. Obviously, the quality of the training and the environment and the high quality of the standards that they have in the US is very big. And that is the reason why a lot of students want to migrate to USA. You have a predictable career pathway in the sense that whenever you travel to the US, once you finish, all your, the 3 years of residency, after that, to get into a job in the US is far easier. And the amount of money that you make after you finish your jobs, it is very predictable. Okay, it is very predictable. I would only request all the new students or anyone who has already joined to mute yourself so that you can hear what we are saying. Okay. And whenever you want to ask any questions, you can raise your hand or unmute yourself and then, or put it in the chat box so that we can answer your questions. So, of course, there is a lot of flexibility in your life. If you want to make money, you can really do multiple shifts and make a lot of money. I know some of my students, they make as much as $4,000 to $5,000 in one night of work that they put in there, which is a lot of money. So you can make good amount of money in the US, depending on how much work you want to put in. And that's why there is a lot of flexibility. You have a lot of internationally board certified options or fellowship options, which you can travel to the rest of the world and practice once you have graduated from the US. Money, of course, is a lot. And you can always come back to your home country and practice once you have traveled to the US. So these are some of the advantages of being there in the US. Now, the eligibility, you should all be knowing that the eligibility of doing a USMLE is that your college or your medical school, you have to completely be in the World Directory of Medical Schools. Your college name has to be in the World Directory. Only then you are eligible to do USMLE. And as of 2024, it is the World Federation of Medical Education. That means your school has to be approved by the WFME. India recently has been approved, and I'm sure there would be colleges in Nepal as well which are approved by the WFME. Only once you're approved by them, you can give the exam. So USMLE is taken in 3 parts: step 1, step 2, as well as step 3. The step 1 and step 2 can be taken from your home country. Beyond that, you have to give an English exam, which is called OET. Once you finish your OET, then you are ECFMG certified. Once you are certified, you can then, go to the US and start your residency. Step 3 is usually a licensing exam, and it can be taken only after you finish all the other 3 steps, and it has to be taken in the US. All right. So this is the main part that you need to know, that the step 1, step 2 are all taken in India. Even the OET, I mean, not only India, but also Nepal, you can take it from your home country, step 1, step 2, as well as OET. You do not have to travel to US. Like before, there used to be clinical exam in US. Now all the exams are taken only in your own home country. So what is the different steps of residency? First, if your college is eligible. Second, you have to give all the steps and get ECFMG certification. That means step 1, step 2 CK as well as OET. Then you get ECFMG certification. Third step, you have to apply for residency with the ECFMG certification. Once you apply for residency, you are called for interview, then you are matching into a program and you get into a 3-year or more residency program. So starting, the minimum number of years you have to put is 3 years, after which you can finish your residency, even up to 7 years, like surgical specialties, plastic surgery, and so many other specialties, you can finish in 6 to 7 years. You have to clear your step 3 because it is a licensing exam, and then you apply for a state board for the license after you finish your step 3. And then once you get that license, you can practice medicine in the United States. This is the small and sweet way to practice medicine. These are the steps. All right. So apart from all of this, like, is that enough to just give the exams? No. Apart from all of this, you need clinical experience in the US, which is called electives. Once you have electives in the US, you are then eligible to go and work in the US, hands-on work experience. There are different types of clinical experience you can have. Like either it is clinical electives, which are just going at the end of your final year. You can go there during your internship time, go and work with 1 or 2 hospitals and do some hands-on work. They are also called clerkships. There are some which are externships where you can work with some private practitioners or private hospitals. And then there is something called observership, where you will not be allowed to touch the patient, but you can shadow. There's also a research opportunity which will give you letter of recommendation. Okay, so these are the main things that you need to do for getting into a residency. Finish your step 1, finish your step 2 CK, then your OET, get ECFMG certification, do 2 to 3 months of rotation in the US, which is called US clinical experience, apply for your residency, go for your interviews, and finally match. These are the only different things that you have to do. But before you match for US residency, you need to know following things. Your CV is very important. Like if 100 people are applying, if everybody has got the same scores, then how will they distinguish that who is more important to, get the residency? So they look for publications, presentations, any kind of honors or rewards that you have got from your medical school, some research experience, a lot of volunteering work, which is non-profit organizations or NGOs or those kind of work. Volunteering work is given a lot of importance. And if you have some professional organization involvement, that will also look good on your CV. Okay, so these are the major things that will look really good on your CV. Whenever you're applying for a US residency, you need to make sure that you have these things in your CV. And what are finally the advantages? Like I started off with the same thing, that what is the pay? A lot of people ask that, is the pay enough to survive in the US? So maybe when you start your residency, 50 to 60,000 is the starting pay, which is about 4 to 5,000 after cutting the taxes, which is just about enough to, have a very comfortable life. You can have a car and you can live in a very comfortable home over there. But after your residency, once you finish your residency, you can earn as much as $20,000 a month, which is a lot of money. And the doctors are almost the most highly paid professionals after lawyers in the US. So the doctors make a good amount of money. What do you do after you finish your residency? You then either go for a fellowship, like a super specialty. You can work in a private practice, either solo or in a group of people, like it's called a health maintenance or a HMO, health maintenance organization. You can work in a group. You can always come back to your home country and have a much upgraded practice, because if you have come back from the US, you can have a much better practice in your home country, or you can go for academics or research. Okay, so this is a very, very short and sweet, since it's a 1-hour session, we have to talk about PLAB also, and also help you understand and answer your questions. I thought, let me just give you a brief description about USMLE and the fact that DAMS is supporting students for the last 12 years now with USMLE. I have myself been in this business for 30 years and sent over 15 to 20,000 students to the US so far. India. So I can definitely support and help anyone who is interested in this journey. If you have an idea about USMLE and you want to know more about it, you can contact me at usmle@damsdelhi.com, and I will also share my number with your coordinators who can then allow you to have a Zoom call with me on a personal basis and ask all your questions, all your queries to me. So in case any of you have any questions regarding USMLE, kindly let me know. You can put some questions on the chat box if you want to, or any of you want to talk to me personally, you can send me an email on usmle@damsdelhi.com. So thank you for the patience and hearing me out. And in case anyone wants to ask about USMLE, I'm here for the next few minutes. Otherwise, we can have Dr. Shubhank can start talking about PLAB. Thank you very much.
Hello, everyone. So as Dr. Mala described everything about your US journey, your US dreams, I think this is the right time when you are in your medical school that you should dream of, working abroad, whether you want to go to US, UK, or any other part of the world. So here at DAMS, we have excellent courses for you for USMLE as well as for PLAB. So there are different
Shubhank,
routes.
there is just one small, I think a couple of questions that have come. I'll quickly answer these 3-4 questions maybe, and then we can have your PLAB thing, because since the students have already put their
Am I
questions
audible?
out before
Any
you
issue?
stop. No.
If you find any issue, please write on the chat.
Yeah, no. I'm just saying, let me just answer these questions, okay? What should a first-year student do to get a head start for USMLE? Basically, if a first-year student wants to get a head start, do really well in your curriculum, because
Any issue?
anatomy, physiology, and biochemistry are very important subjects, and you need to make sure that you're doing really well in these subjects. So you need to make sure that curriculum-wise, you're studying these 3 subjects and trying to be on the top of your class. The second thing you need to do is try to be a part of voluntary organizations, try to be, try to do those kind of things so that you do very well with starting to do this work. Like, or if there is any research opportunities that are there in your first year, although it is too early to start research work in the first year, but extracurricular activities, voluntary activities, and doing well in your curriculum would really give you a head start for USMLE. The total cost of USMLE exams only, each exam costs about 1 lakh Indian rupees, which would be slightly more with the Nepali currency, 1 lakh per subject. And then beyond that, traveling to the US, doing your rotations would cost you another 3 to 4 lakhs, sometimes even up to 5 lakhs. And the entire process costs about 15 to 20 lakhs. Okay. But you start making money almost immediately. And once you make your money, you can also, if in case you have taken any kind of loans, you can actually start paying back your loans. Okay. So I think I've answered your queries. If you have more questions, keep letting me know so that I can answer your questions while I'm here for the next few minutes. Okay. Yes, Shubhank, I think you want to carry on. You can start.
Okay, fine. Hello, everyone. As Dr. Mala described in detail about USMLE courses and your, US dream, your US journey. Now I'll be talking about your UK journey, your UK dreams. So for UK, what is most important is that you have to give PLAB exams. So there are different routes. For example, there is a route such as Royal College exam like MRCP, MRCS, membership exam for emergency medicine, pediatrics, OBGYN. The other route is MTI route, medical training initiative routes. And like if you are a medical student in your internship or final year, the best route for you is PLAB route. For this, you have to give PLAB exams, that is PLAB 1 and PLAB 2. PLAB 1 you give after passing your English exam. So before writing your USMLE or PLAB, you have to pass English exam, which is either OET, Occupational English Test, or IELTS, IELTS. If you are writing IELTS exam, then you have to score minimum 7 in each band, that is listening, reading, writing, and speaking. And if you're writing OET, then you have to at least get B in all 4 modules as listening, reading, writing, and speaking. So the grade you should get is B minimum and 7 in each in IELTS, or total overall of IELTS score of 7.5. If you are clearing exam with this score, then only you can book your PLAB 1 slot. Even if you want to give MRCP or want to go with any route, English is compulsory because you will be communicating with the patients there. So it's mandatory that you pass English with the required scores. So once you pass your OET or IELTS, then you book your PLAB 1 exam. So what is PLAB 1? It is basically an exam you write to get the license to practice in the UK. This license is given by General Medical Council, right? In every country, there is a medical council which gives you a license to practice. So in the UK, this is given by GMC and it is known as GMC license to practice, which you get after clearing your next step, which is PLAB 2. So PLAB 1, you get 3 hours. It's a multiple choice question exam, MCQ based exam, where you select the right answer. PLAB 2 is a OSCE exam. So in OSCE exam, you enter the hall of General Medical Council. There is a building, where there are 16 chambers or 18 chambers. These are just like, consultation chambers, where there is a patient sitting who is actually not a real patient, but somebody acting. So a patient simulator is sitting who will be acting like a patient, telling you all the complaints in normal practice as you will see a patient. You will be there as a junior doctor when writing this, giving this exam, and there'll be another doctor sitting who will be judging you, who will be giving you marks. Accordingly you pass that station. So there are total 18 stations in PLAB 2, out of which 2 are rest stations. So in these 2 stations, you find maybe water, cookies, tea or something, so that you rest there, you relax, you calm your nerves, whereas other 16 stations are clinical scenarios for you. So clinical scenarios would be, for example, you are FY2 doctor and you see a patient coming in emergency with chest pain. So how you will manage? So here they'll be checking your interpersonal skills. They'll be checking how you interact with the patients, right? So if you are, just you have to act the way you do in normal life. So this is all about PLAB 2 exam. PLAB 1 is your basic clinical knowledge. So the subjects you have, your medical subjects more. You have your general medicine in it, cardiology, neurology, rheumatology, pulmonology, respiratory medicine, general surgery, pediatrics, obs gynae. There is not much of basic subjects. Mostly you are, asked about the clinical subjects, what you see as an intern, what you see in your clinical practice. So these are the subjects where they ask common questions at the level of a junior doctor, what a junior doctor should know. They expect that your knowledge should be of junior doctor and you practice safe medicine. So you have to be very safe doctor as well. So you will find most of these questions are easy questions, but clinically, clinical scenarios, right? Where they are asking you that if you are in this situation and a patient comes with these complaints, what would be your next step? What would be initial management? The basic, handbook you read, like Oxford Handbook of Clinical Medicine or Emergency Medicine, what you all practice as an intern or junior doctor. So these kind of questions are asked in PLAB 1. So PLAB 1, PLAB 2, after that you apply for your GMC General Medical Council license. Once you get your license, then you apply for the jobs. So there are different websites available for it, like Track Jobs, NHS Jobs, different websites available where you make your online CV. You put all the credentials, what all courses you did, any training opportunity, any teaching opportunity you had, like teaching the junior students in the medical school or nurses in the medical school, any sort of CME or webinar, seminar you have attended, any sort of poster presentation, any research, and they do something known as clinical audit and quality improvement projects. So these are also few things you can do when you are a medical student in your college. Like audit means you compare the, the findings of your ward and compare it with the national guidelines. This could be like the infection control practices. This could be anything, any clinical parameter. So that can help you. You can do a small project and also something like quality improvement project, so that with your, your steps, some improvement has been, noticed. So all that can help you. What is most important is the documentation. Sometimes as a medical student, you attend a lot of webinars, seminars, but you forget to mention all that in your CV. So it's good that if you mention all the seminars, webinars, courses, what all you do in your student life, mention it in your CV. Any sort of multidisciplinary meeting you do, for example, there is a case of, say, suspected lung cancer. Physician has seen a lung mass in X-ray, and then he has, called to radiologist, or some hospital have a multidisciplinary meeting where, clinician, radiologist, surgeon, pulmonologist, oncologist, they sit together. So that's a culture in the UK where, they discuss things in multidisciplinary meeting. So that kind of meeting, if you have attended, usually you would have seen, your consultant physician would talk to radiologist, would talk to surgeon, would talk to oncologist, and they do a meeting. So that documentation can also help you that you have attended multidisciplinary meeting. And the role of allied healthcare professionals, you know, physiotherapists, occupational therapists. So that is also part of team. So that also, you can mention that you have worked in such teams. Uh, Next is how you can prepare. So like I have seen a lot of students used to struggle, like because there was no proper course, there was no proper, Q bank or things available. So we have started this amazing program at DAMS, Delhi Academy of Medical Sciences. So there is a very detailed course by the NHS clinicians. We all are the practicing doctors there. So we have updated, what all nice guidelines you should know, what all important topics you should know as a junior doctor. So those are available in the course, where there is a detailed Q bank covering most of the, the important things which you should know as a junior doctor, as well as, discussion. So that can help you to get knowledge about this exam. You can check this course, have a free trial, and see how this course can help you. And further, we could, answer your queries if you have. So in nutshell, you start your preparation as English exam first, pass the English exam, IELTS or OET. Next is your PLAB 1. You need a course to, prepare for it, so that you are well aware about the guidelines and all, because you are giving this exam from different countries. So you should know the UK best practice. Third is passing the OET exam. Fourth is you apply for the jobs and then interview preparation. What sort of common questions they asked in interview about, your introduction, clinical scenarios, ethical scenarios. So these are the few things, where you need some guidance, some support, so that you pass this exam, easily and you get a job there. So in the UK, when you start your journey, you have different options. Number one is, you do a non-training job. It means you are not doing a residency training there. You are doing a non-training job. So you do that job, and during that, if you want to apply for the training, you can apply. And during that, you can give your Royal College exams, and then you can do your specialty training and become a consultant. You can directly go into the training programs also, but usually it's found difficult for the international medical graduates directly entering the training pathway, because you have to know the basic system of the NHS and how the hospital works. Every trust has their own policies and system. So it is always advisable that for 6 months you do your non-training job and then enter into the training what you would like to do. So I would say, sometimes you think that you want to be, say, a pediatrician or a radiologist or a surgeon. It depends, on your interest and everything. But if you do the job there for 6 months in the UK, then you can take a better decision, I would say, because exposing yourself to that environment, that's sort of work and life balance, what all you expect. So then you can take a better decision what kind of residency you want to do in the UK. So you can easily get whatever you want to, whether you want to be a radiologist, you want to be a surgeon, you want to be a pediatrician. So all those specialties are available. There are different routes for it, but whatever is your interest, you can get easily in the UK. No issues with it. Just you need to prepare your CV accordingly when you are applying for these training jobs. So I think I have covered most of the things regarding PLAB exams and UK journey. Now, if you have any questions, you can ask in the chat box. I would be very happy to answer.
A very good evening to all the medicos and to our prestigious guests, Dr.
Can you
Mala
repeat the
Srinivasan ma'am.
sequence? Sure. I can repeat the sequence.
Hello.
Yes, definitely we'll be uploading this video also on the YouTube so that you can follow. So the sequence is English exam, that is IELTS and OET, which you can give when you are in your internship. Then is PLAB 1 exam. This also you can give when you are in your internship. So after passing PLAB 1, you give the PLAB 2 exam. And after PLAB 2 exam, you apply for the jobs, right? You prepare your CV. And then fifth stage is the interview preparation. So we help you in all those prospects so that you are able to know about, what is the job description for a junior doctor in the UK, right? So basically, yeah, which degree we'll get after doing PLAB? Is it MD? And after PLAB, anyone can return their own country and can practice. Definitely. So PLAB is a exam with which you get your license, right? And then in the UK, if you want to be a specialist, if you want to be a consultant, or you want to practice in the community. So if you want to practice in the community clinic, that is known as GP, general practitioner. For that, you do GP training and you do MRC GP as an exit exam. Whereas if you want to be a consultant, then you do your specialty training and you do your CCT, core clinical training exam, and then you become specialist of, that specialty as a consultant in the hospital, right? So there, it's not like the Indian or Asian system of these kind of degrees. During this pathway, you can practice your Royal College exams, and definitely you can visit. You can come back to your home country. One student has asked, how difficult is it for matching surgery in USMLE as well as PLAB? So definitely it's easy in PLAB. It depends on your interest. So as I mentioned, you do a non-training job maybe in any surgical department like general surgery, GI surgery, urology, vascular surgery, neurosurgery, and then you develop your portfolio accordingly. And then you, during that give your MRCS, and you have a lot of opportunities to become a consultant there, a specialist there. For example, there is a CESAR pathway, CASR route. There are other routes as well. So you can definitely do surgery there. And, some of the fields are definitely competitive, but that doesn't mean that you can't do. If you prepare your CV well, if you have gained experience in that particular specialty, there are higher chances for you to get that particular specialty in the UK. It's not difficult. Good evening, sir. Do we need FMGE certificate? Yeah, that you have to ensure, like this certificate, whether you need, because some students, some FMGE has given directly also. So I think for PLAB, this is not a requirement. For General Medical Council registration, wherever you are working as intern, you always take a provisional registration with which you can apply. So that provisional registration can definitely help you. Any more question? Yeah. What is the initial salary after PLAB? So when you start after the PLAB, so definitely as a junior doctor, your salary ranges from say 32,000 pounds to somewhat around 40,000 pounds. Then it depends how much clinical experience you have. Are you entering at a level of FY1, FY2, that is foundation year 1 and 2, which is equivalent to your internship year? And if you have more experience, if you have worked in a house job and all, then definitely, there could be more this thing paid to you as per your incremental credit. So this is the basic salary. And then after that, once you are progressing, then you do night duties also, you do locum work also, you do out of social hours that work also, so where you are paid more. So salary is good. As per news, Nepal Medical College is not recognized. So definitely you can check with the website. I'm sure that most of the colleges are in WHO list of medical schools. So if your medical school is in that list, you can apply for it. If your school is not in that list, you can write to the GMC. They can help you with that. You can write to WHO list also. They would add. So try to find out if you have a senior. I know a lot of medical colleges in Nepal are in the list of WHO list of world medical schools, and many doctors are practicing in the UK. Now, one student has asked, how can students improve their CV if they are already in final year and haven't done much volunteering earlier? So volunteering doesn't mean a very long volunteering program. If any short volunteering program during your vacation you want to mention, any society, any membership you have taken, so all that you can mention. Wherever there is an opportunity, if you have visited some, geriatric care center, if you have visited some special school where you have conducted something, all that can be mentioned in volunteering. Rest, it depends more of training. If you have taken some courses, some online courses you can do during your internship time, you can teach and train the junior students. That certificate you can also mention. Any research publication, if you have, like in your medical college, any research going on where you can be part of it, so that can also help you in building your CV. Right. Next question is, what is the total cost for getting your MD/MS degree in the UK? So in the UK, this system is not like gaining a degree. Ultimately, you are becoming a consultant, right? So after your MBBS, which is known as primary medical qualification, you give your PLAB exam, you get a license to work in the UK from the General Medical Council. That is after passing PLAB or Royal College exams, right? So after obtaining your license, you apply for jobs. These are non-training jobs or training jobs. So non-training jobs where you are not doing any specialty training. You are working in that particular specialty as a doctor. Through this route also you can become a consultant. If you go into specialty training, through that route also you can become a consultant where you write your CCT exam. So ultimately it's not about getting a degree in the UK. However, you could put it in right words saying that you are becoming a consultant, a specialist in the UK, right? You can become a GP, general practitioners, or you can become a hospital consultant, depending upon the specialty you are doing or in which area you have keen interest. So those opportunities are available. As I mentioned, there is a CESR route also if you're not opting for this specialty training. Any other question anyone has? So I'll just try to showcase a small this thing where I have answered all important things in PLAB which could help you. So this on the screen, I'll show you all the facts for PLAB 1 and PLAB 2, which can really help you with all your important questions. And if you have any queries, you can reach out to us anytime. We are already having a group with your college representatives, and the same video would be available on YouTube, which you can share with your friends and reach out with your queries anytime you want. All right, I'll be just showing you a fact sheet FAQs on PLAB 1 and 2 to help you with most important questions asked for UK journey. So PLAB is the license exam to obtain your license in the UK, known as General Medical Council license. Do you need experience to be eligible? No. In your internship year, you can apply for it. You need not to do any extra, years of job. How is the structure? So PLAB 1 is a 3-hour exam where there are 180 questions, multiple choice question, based on the knowledge of a junior doctor, an intern level doctor. Whereas PLAB 2 is an OSCE exam where, as I said, there are 18 stations. Out of 18 station, 2 are rest station and 16 are clinical scenarios. So that exam you give as PLAB 2, and after that you get a GMC license to practice. Do I need to come to the UK for PLAB? So PLAB 1 is conducted all over the world. You can book in Dubai, India, lot of countries have PLAB 1, whereas PLAB 2 is only done in the UK at Manchester, at the Office of the General Medical Council in Manchester in the UK. So for PLAB 2, you have to travel. So as I mentioned, what is the total score required? So for IELTS, you need at least 7.5 overall and minimum 7 in each section of listening, reading, speaking, and writing. Whereas for OET, Occupational English Test, it is B, all B in all 4 aspects, as I mentioned, listening, reading, speaking, writing. What is the cost? So OET will cost you some 33,000 Indian rupees, somewhat same for you in Nepali rupees also. IELTS will cost you somewhat 16,000 rupees. PLAB 1 will cost you roughly 25,000 rupees. PLAB 2 would be around 90,000 rupees. And then you have to include some cost of traveling to the UK, visa cost, if you are doing any academy, any preparation. So is there any coaching available in India? So since New Delhi is very near to you, so we have started a full-fledged program here at Delhi Academy of Medical Sciences, which includes recorded, live, QBank, and the overall preparation for PLAB 1 and PLAB 2. So all those details are available on the DAMS website, on the DAMS social media accounts also. We have earlier also recorded some YouTube video with all the details. So you can opt for these programs during your internship time and start preparing for, these exams while you are preparing for other exams, so that you are well aware of the structure. So the subscriptions are available like 6 months or 12 months. So it would be very easy for you, like you start preparing in advance, right? And then is there a coaching, as I mentioned, and other advantages of doing this course that we all are NHS clinicians working in the UK, and we have designed this course so that your life journey is easy. Everything is streamlined. Sometimes you have to, find out things from friends. Every friend is busy there, so you don't get the right amount of guidance. So here, at least in New Delhi, you have everything available. There are proper coordinators to help you at every stage. Your beginning of the preparation, your application, your CV preparation, passing of these exams, how to prepare for interviews and everything, so that there is proper hand holding for you and you are more confident when you are giving this exam, right? It's an exam of your medical knowledge and interpersonal skill. PLAB 1, they judge you more on your medical knowledge as a junior doctor, whereas in PLAB 2, they judge you on the interpersonal skills, how you communicate with the patient. So these things are quite important. So we are always there as your trusted partner at DAMS. You can, contact us. Already college representatives have made a group, and DAMS details are also available. You can ask your queries. You can ask further details. We would be very happy to answer. Any other question? Yes, recording would be available. I got a message. Yes. We will share the recording. We will also upload this on the social media so that you can follow it and share with all your friends. There are different other programs also from DAMS side where, even if the juniors in your medical college from first and second year want to, understand things better, there are different other programs covering your initial years of MBBS. Also, those programs can also help you. For that, you can take details. Okay, fine. So we would request all of you to switch your camera and, wave so that we can capture this beautiful shot. I would request everyone to switch on your camera, please. All those who are here, some have left, no problem, but still around 62 students are available. 60 doctors are available. Yes, very good. Please switch on your camera. Very nice. I'm so happy that representatives from all 9 medical colleges of Nepal are available. You can always contact us for any queries you have. I think most of them have switched on their camera. Very nice to see you. And I would like to wish you all the very best in your abroad journey, whatever pathway you want to choose, whether you want to go to the US or to the UK. You have a very trusted partner. DAMS, Delhi Academy of Medical Sciences, started by a very famous radiologist, Dr. Sethi. Lot of good courses available for you. which can really help you in your, medical journey. It's so good that you have so much of digital knowledge available now. So this can help you to ace any exam. So reach out to us with your queries. We would be very happy to answer. When we are uploading this video on social media, there too you can ask your questions. Your college sorry, representatives have a group where you all can be added and ask us anytime. So thank you so much once again for joining and listening to us. It's indeed a great pleasure talking to all the young bright doctors. Stay motivated. The only way is to love medicine. You know, keep yourself motivated, motivate each other, and love medicine. Bye. Take care.